I'm with my name is Randall. I'm with Hollister, so I'm your representative. The hospital this week is in the process of changing over to Hollister Ostomy products. So we will be removing those and replacing these with new products. This is a formulary sheet that we will be leaving at each nursing unit. This is probably going to be your best tool to refer back to later on to help you understand which products are being stocked here at your hospital. You just have a few items in your supply room, but this actually shows you all the items that are going to be in central supply and will be available for you all to use. Okay, so I've got a little ring on it, hang it up somewhere so it doesn't get lost in a drawer. And I'm going to review just some of these products and some of the differences from what you currently have now. So I'm not going to spend a whole lot of time on it, but this is going to be great once again. This gives you a picture, a description, the item number, and then actually application tips on the far right side. The pouches are on the front. The accessory items are here on the back. So I'm just going to start here with this first one here. This is a one-piece pouch. If you all are using a one-piece, some of the differences is our skin barrier, we have a new technology called Cera Plus. It's infused with an ingredient that helps to keep the peristomal skin healthy. So we want this to have direct skin contact. So don't put a skin prep wipe on first. Just apply this directly to the skin and you'll get the best results that way. On the back, there's a cover on both the front and the back, but this is what we call a viewing option. So that you can raise this up to see into the bag, to see the stoma, or to help you with placing it. And then the cover just lays down, but you can raise this to view. Our closure is a little bit different from what you're using now. It is built in. Ours is called lock and roll. What you have now is Velcro. One thing that's nice about this, it's all plastic, so you can wipe it clean if anything gets on the outside, if it gets stool on it. And the way it works is you're going to roll it down 3 times towards the direction of this little flap right here. So once, twice, 3 times, lay the flap over, pinch it together, you'll feel it locked together. And then to drain it, you can simply just unroll it, take it, squeeze it open, take tissue paper, clean around the stool around the bottom edge, and then roll it back up again. So our closure is the same on our one-piece or our two-piece. It works the exact same way. The next thing on that formulary sheet is our two-piece products. You're going to have 2 sizes. You're going to have a 2 3/4 inch flange and a 2 1/4 inch flange for stools. Okay? And one thing that's different on our two-piece from what you're using is we have what's called a floating flange. That means you can slide your fingers underneath here and actually grab a hold of this. And then you're going to take your pouch, you line that up, slide your fingers underneath the flange and on top, and then you pinch it together and it'll click and lock. And so you actually know that it's sealed and closed. And so you can teach the patient. They don't have to be pushing and pressing on their stomach. They actually just can slide their fingertips together and pinch this together. So that's different on the two-piece. Once again, the closure works the exact same way. Then for the next thing on here, for a urostomy patient where the output is urine, you're going to grab a kit. This is a 2 1/4 inch kit. Everything comes all packaged together. So inside of the kit, you're going to get your 2 1/4 inch barrier, which once again has the floating flange on it. You're going to have the urostomy, which is a twist drain valve, teardrop facing open, outward is open, twisting around this way is closed. And then you'll have an adapter in the kit that you can push on, and that allows you to connect to the bedside collector. So just make sure that is open. Urine flows down to the bedside. You don't have to worry about draining this. Okay, so that's for the urostomy. Last 2 items on here, this is just talking about the individual pouches. I've already shown you those. And then we also have 3 different sizes of wound collectors that will be available if needed. On the back, the main thing I want to emphasize is this barrier ring, which is listed here at the first top part. You'll want to grab maybe a handful of these, put these in the room. You're going to use one of these each time you change your pouching system. This is a great preventive step to put down to make sure you prevent leakage right around the stoma. So basically you'll grab one of these, open it up, pull this out. This is a kind of a moldable Play-Doh ring. Pull the cover, there's a liner on the front and the back, pull that off. This is stretchy, it's sticky and tacky. This is the end result. So I pinched off a piece of the ring to fill in, pretending that there's a little crease right up here. Fill in that crease. You want to fill in any creases and dips around the stoma. Take the remainder of the ring, stretch it, put it down right around the stoma, and that's going to seal right around this edge, especially if you don't cut your hole opening just right, and that'll prevent leakage right around the edge and keep things off of the skin. So then take your one piece or two piece, whatever it is, cut your hole opening, peel the liner off, and then you're going to take this and lay this and put this right down on top of the ring, and that ring and the back of the barrier will seal together. Then when it's time to remove this, put the whole pouching system, you'll take this off, you'll remove the ring, put a new ring on, and put a new pouching system on. Okay? The rest of these accessory items are very similar to what you have now. The last thing I'm going to show you guys listed on here is our adhesive remover spray. So this particular item comes packaged in a red and white box. This is what it looks like. It's stocked down in Central Supply. And this can be used anywhere in the hospital to remove anything adhesive from the patient's skin. This really helps to prevent skin stripping and skin tears. And so it's silicone based, there's no alcohol, so it's pain-free to help remove anything from stat locks, tegaderm dressings, wound care, tape bandages, all the different things, stat locks, different things like that. I want to do a real quick demo. If I could borrow somebody's forearm. If I borrow somebody's forearm real quick. You got a forearm free? So I just like to put this this tape on here just to kind of show you how easily and quickly. This also saves nursing time on being able to remove something. So whatever it is that you're going to remove, whether it's a big dressing, small dressing, take this, press it to break the seal, and then just spray and saturate the outside edges of the dressing. If it's a porous dressing, you can go ahead and spray the whole thing, and that just starts to work to break the adhesive down. And you'll see that it starts to release around the corners and the edges. So when you get an edge broke like that, then just take it and then you can spray back behind as you remove it, and that will come off very easily. This will dry in about 10 seconds, so you don't have to worry about wiping it or washing it off, and then you can reapply another dressing directly on top of that. So you can see that's already gone. It doesn't leave any kind of a residue on the skin. So pain-free removal, easy to use on any type of a patient. So that's listed and is being stocked in Central Supply. Any questions?